Welcome. I'm Brian Irwin. This is Scott Thomas. We're here to talk a little bit about RMS, the history of how we formed, and what we do in this world of healthcare. Scott, tell me a little bit about yourself. How did you get into healthcare?
I was born in a hospital.
That's good. Quality movement.
Yeah.
Wasn't sure. You're from Louisiana,
Yeah,
so it could have been the Bayou.
The hospital could have been in the Bayou.
It probably was.
My mother actually was a healthcare consultant, managed quite a few healthcare practices, and so my first job was doing very laborious tasks, filing and things of that nature. And then I got into digital archiving of records, and that kind of led one thing to the other. I decided healthcare is the only thing I know, and so fast forward, we formed this.
It's a big move. So your mom, we have your mom to thank for RMS, is what I just heard. I'm going to let her know that too. So, or blame, yeah. One of the two. So with that, I know a little bit about the history of RMS and how you formed it, but why don't you share with everybody how the wondrous efforts that were undertaken to build RMS as a company initially?
Yeah, so originally Paul Cohen, Big Paul, and I were at another company and left that venture and were talking to some of our friends in Lafayette, Louisiana, one of my best friends, kind of discussing what we had been doing, what we were considering doing, and the idea of basically the seed of RMS came up, and the idea of starting a company to go do what we have since basically achieved was kicked around over a period of months, and it was a daunting task, more daunting probably than we even realized. But eventually we decided let's go forward, and there was a group here in Oklahoma City that, as part of a company that they were currently operating, had a healthcare initiative that, in a encapsulated format, we purchased that asset, took some of the team members, and the original foundation forming team of RMS kind of came along for the ride.
So nice. That's a short version I heard, but I heard there was a lot of fun getting that all built out together and doing that. But it's great that you were able to get an asset from a former company to be able to really get into doing this. One of the things that I think is good is that RMS really started out as a technology company and not a offshore keying vendor. So if you can share a little bit about that vision of RMS and how automation played a major role in the formation of the company.
Yeah, so from day one, we maybe audaciously believed that we could automate this process of lifting data from EOBs and matching payments to remittances, digitizing the whole process, and doing so both onshore and at a very low touch point. As you know, kind of knowing what we know now might not have been the smartest effort to endeavor upon, but we've pushed through. Now it looks like it was a great outcome, but there was a lot of questionable years for sure. The automation has become the hallmark of the company, of what we do here, and really that constantly pushes us to be better. There's always room for improvement. No matter how sharp the blade gets, you can always hone it a little bit more.
So with that, one of the things that I think is a great value for me is not only the technology, but the people that create it. Can you just explain a little bit about our technology people, our technology group that we work with, and the amazing things that they do and continue to do?
I can try to encapsulate that. Yeah, that's where the real brains of the operation is on the technology side, and being able to truly differentiate ourselves as a technology company is the driving force behind the company. It allows us to keep our labor very, very low relative to anybody else in the industry, and again, to do everything here onshore with people in Oklahoma City. But our tech staff is the heart of the company, as you know, and it's what really allows us to differentiate ourselves. So there's all the components: IT, Dev, DevOps, database. It's all putting it together under the watchful eye of Greg at this point, Greg Bugaj, and it's way over my head. But getting to stand up and represent it, kind of being the face of the company, isn't a bad gig.
Yeah. No, making sure. I mean, I think that the other value we have at RMS is our other employees that implement that technology or support it, or our day-to-day operational team. I think that that's a great piece that we've seen lately with our operational team kind of growing into their own from the standpoint of really becoming a valuable, continuing to be a valuable part of the company from that standpoint. Anything you want to say about that group?
The entire coalition, if you will, of various teams here working together to, like you said, implement, support, and improve the product. It's constantly looking at what we do, how we do it, the results of what we're getting, and then under a magnifying glass, really examining what can we improve, where can we find more efficiencies, better output for our clients, and talking to the customers to see what it is that we could do better from their perspective. But operationally, our development team is really, really good at building things. They wouldn't know what to build if the operations team didn't identify, okay, now on a daily basis, this is the number one thing that we're having to manually touch.
Right.
As we constantly remove the number one thing, something else has to take its place as the next highest thing, the next highest thing. And so being able to not only understand what is causing the touch point, but then figuring out the most efficient and logical way to solve it, it's definitely a group effort.
Great. All that together, one of the things that I wanted to ask you about is putting yourself in the healthcare provider's position. What do you see as really driving the value that is RMS when you look from their perspective?
I think it's trying to, same thing that we do on our side, trying to provide the same value on their side of just more automation so that what they do on a daily basis is see patients to actually provide care. The more time they can focus on providing care to the U.S. population, the better off we all are. The administrative overhead tied to payments, claims, reconciliation, correspondence, any of that is just less than a great investment of human time. So taking these people, putting them back to work where they can actually add value, get more patients through the door, more people seen, and more accurate bills back down to the patient or to the family member responsible. It's just trying to remove any unnecessary burden.
Yeah, I totally agree with that from the standpoint of really trying to make that automation and visibility into several products and in different industries is great. To kind of wrap things up, anything that you wanted to add so people know about RMS, anything that maybe I didn't ask you about or we didn't cover from the standpoint of what makes RMS great and why we really enjoy working with all our different customers?
It's truly the people, and you know this. I think that's probably what's kept you here all these years. There's been a lot of insanity, but both on the employee front, the investor front, and the client front, we get to work with some great people, and it's fun to be able to try to tackle something that others either haven't done or haven't been successful with and feel like we're succeeding and making a difference.
Yeah.
It's all about the team around us and being able to work with these people to improve the lives ultimately of the patients involved in this whole process, but being able to give back to the employees and seeing their hard work rewarded for them, and they realize they're part of something. They're not working for Scott, they're not working for RMS, they're working as part of this, and it's theirs to be proud of just as much as ours. That's undoubtedly the most rewarding piece of this.
Yeah, I completely echo those statements. So thank you for watching the video. If you'd like to find out more about RMS, please go to rmsweb.com. Hit the contact page and reach out to us.